So how do you brush your teeth properly? How do you floss? And what are some of the most common mistakes that we all make? Well, I've come to get some expert advice from my friend and dentist, Dr Ehsan. So what are we waiting for? Let's dive in. Now when it comes to brushing your teeth, remember, you need to be doing it twice a day for 2 minutes. Let's first begin with how to use a manual toothbrush. Using the correct toothpaste, begin by placing your brush at a 45-degree angle against your gum line and gently start brushing your teeth in short circular strokes away from the gum line. Visualize splitting your mouth into 4 sections and focusing 30 seconds on each section. Using short back and forth strokes, you need to be brushing all the surfaces in your mouth, the inner, the outer, and biting surfaces of your teeth. Next up, we have how to use a rotating electric toothbrush. Using the correct toothpaste, begin by switching on the electric toothbrush when it's against your tooth. Place your brush at a 45-degree angle against your gum line. Run the brush from tooth to tooth. Again, as explained previously, visualize splitting your mouth into 4 sections and focus 30 seconds on each section, covering all surfaces. Next up, we have flossing. First, break off about 45 centimeters of floss and wind around your middle fingers. Hold the floss tightly between your thumbs and index finger with about 1 inch of floss between them, leaving no slack. Now using a gentle rocking motion, guide the floss between your teeth. When the floss reaches your gum line, curve it into a C shape against the tooth until you feel resistance and scrape upwards away from the gum. Repeat this process on the other side of the gap, along the side of the next tooth. Keep a regular pattern and work your way from left to right so you're less likely to miss any teeth. Now let's move on to those tips and tricks. So I think one of the most common mistakes that even I see patients making in pharmacy is rinsing their mouth out after they've brushed their teeth. Should you do this? Should you not do this? And why shouldn't you be doing that?
So you should be using a fluoride containing toothpaste. Okay. After you brush your teeth with it, you should be spitting out the excess toothpaste that's in your mouth, but you shouldn't be rinsing with anything, water, mouthwash or anything. The reason for that is the toothpaste contains the fluoride, and that fluoride should be on the surface of your teeth. You should allow it to stay on the surface of your teeth to do what it needs to remineralize the surface of the teeth. If you rinse with anything, including mouthwash, you're washing away all that fluoride. So that takes away the point of putting that toothpaste on the surface of your teeth.
So it's like a protective cover.
Yes.
And when you rinse it out, you ruin it. So in this video, we've taught people how to brush their teeth and how to floss their teeth. Now, should these be done in any particular order, or is it okay however you want?
It's better to try and floss first, and that's to get rid of the food particles that are in between the teeth, to then go ahead and brush and clean all the surfaces in between the teeth. Some people prefer to do it the other way. It's as long as you're brushing and flossing, that's the main thing. Flossing first is ideal, but it's not absolutely necessary.
So it's fine to do it either way, but if you did floss first, it's going to open up them areas and the fluoride is going to be able to go into the places it might not be able to go.
So it would be better to floss first.
Following on from the last question, what about mouthwash? Should that be done in a particular order, or can you brush your teeth and then use mouthwash at the end? Because that's what you see in a lot of the movies, sorry to interrupt. People usually brush their teeth, don't they, and then mouthwash and gargle it and spit it out. What do you advise?
If you mouthwash straight after brushing your teeth, you're getting rid of all the fluoride that's in that toothpaste. So that goes against the point. So it's best to give it at least, I'd say, half an hour before you do decide to go ahead and use a mouthwash. But if you do want to be using a fluoride containing mouthwash, then do that in the time in the day that you've eaten but you've not brushed your teeth. Say for example lunchtime. If you're not brushing your teeth at lunchtime, use a fluoride mouthwash at that point. But if it's just a fluoride mouthwash that you're using, there's fluoride in the toothpaste, so there's no need for you to be using a fluoride mouthwash immediately after putting the toothpaste onto the surface of your teeth.
I mean, I guess you're just wasting your money by doing that.
Pretty
you're
much.
Just wasting mouthwash.
Some people need mouthwash for different things, for example gum disease, but that's a different story altogether. So if they do need a specific type of mouthwash for the gum disease, that shouldn't be done immediately after brushing, that should be done about half an hour later. So
in terms of changing your toothbrush or changing the head of your electric toothbrush, how often should people be doing this?
It's recommended for you to be changing it every 3 months ideally. So yeah, I'd say every 3 months.
Perfect. That was a nice easy answer.
Yes.
I enjoyed that.
Please, more of these questions.
Thank you. Now I know that certain foods have different acidities and you're meant to leave a certain amount of time before you actually brush your teeth. So how long should people actually wait after they've eaten until they brush their teeth?
Ideally around 15 to 20 minutes to allow the mouth to remineralize the surface of the teeth so that you don't damage your teeth by brushing them straight away. Now if you've consumed foods that are acidic, such as orange juice or citric acids or whatever, it's best to try and neutralise the acid in your mouth by rinsing your mouth with water immediately after, just to change that pH and reduce the acidity that's in your mouth. But in terms of brushing, give it 15-20 minutes before you brush.
15-20 minutes. And I think what we will do as well, if it's okay with you, we'll leave in the description below some more information on acidic foods.
Of course, yeah.
I think that'll be useful.
Yeah, sure.
Now when it comes to flossing, I do know that some people don't like the actual physical act of flossing, or their floss keeps ripping as well. So do you have any advice on that?
If the floss keeps ripping, there may be a reason as to why it's ripping. It could be a defective filling or defective margin of the crown or a veneer, or there may sometimes be an issue. So do see a dentist and get it checked and see what the cause of the rip is and have that corrected. If you don't like the physical act of flossing, there's different alternatives to flossing. So there's floss picks, for example. So it's a piece of floss that's on a stick and you literally just use it to put in between your teeth, and it's so easy. So that is a good alternative to just the manual floss itself.
Yeah, because I think sometimes it can get a bit painful on your fingers.
Yeah.
I mean, I prefer the floss picks.
Yeah.
And following on from that question, what if the gaps are too big so you feel like the floss actually isn't connecting on anything?
Flossing is usually done between teeth that are in contact. So if there's a bit of a gap between the teeth, or if there's gum disease or anything like that, it's the little incidental brushes that are ideal to be used. So they come in different colours, the different sizes, the different colours, and you have to be sized up to see exactly what colour you should be using for the different gaps.
So in terms of toothpaste, is there any toothpaste that you would recommend patients to use or you wouldn't recommend them to use?
What to look for in the toothpaste is the fluoride content. So what I wouldn't recommend to be using is toothpaste that don't contain fluoride. So you can find them in some health shops.
So they exist?
They exist,
really?
and they're not really beneficial. But the different quantity of fluoride in the toothpaste is dependent on the age of the patient. So we can leave the description of the different age ranges in the description.
Yeah, sure. How much toothpaste should we actually use?
A pea size is sufficient. For children under the age of 3, a smear on the toothbrush. Otherwise, a pea size is sufficient.
So in terms of cleaning your tongue, this is often something which isn't mentioned much when it comes to cleaning your teeth. Is it something that's recommended? Should you do it often? Should you do it every day? And can you use your toothbrush to kind of clean your tongue? Is it okay?
You find that a lot of bad breath originates from the surface of your tongue and the bacteria that sits on the surface of your tongue. So it's important for you to be brushing your tongue as well as your teeth. But it's very difficult to brush your tongue with an actual toothbrush. So that's why there's tongue scrapers. There's a specific device that's used to clean the surface of your tongue. You can find them from chemists and from dental practices. If you don't have access to one of them, there are also parts on the back of the actual toothbrush head that are for cleaning the surface of your tongue. The little bumps that you find on there.
Certain toothbrushes have
Certain toothbrushes have them, not all of them. But if you don't have either of them, then just use a toothbrush. But it's best to either use a tongue scraper or use a toothbrush that has the tongue scraping bit on the back of the head.
Thank you so much, Dr. Ehsan, for taking the time to help with this video. I think anyone who's watched this video is now going to be a pro, and I guess you've got no excuse for bad oral hygiene. Even I've learned a few things today. See you next week.
Is that it?
That's it.
Really?
Oh! Please don't forget to show some love to Dr. Ehsan. I always forget to do this bit. He's got a wicked Instagram account. I'll leave a link up here and in the description below. So feel free to show some love to him for taking the time out to help with this video.
Thank you very much.
See you next week. Excellent.
It's best to try and brush first. And
Dr. Floss first. I should be the dentist in that chair. I should be on the big bucks, sat in that chair, not here.
Says ATB.
Abraham the pharmacist. Action. I just wanted to do that for jokes.
I'll do action.
You send me it?
Yeah, sure, I will do.
Email me it.
Yeah.
Email it to my agent. Okay. Email me it. Just email me it, bro.
3, 1, action.
This is going to be so hard to film.
You brush your teeth with a fluoride mouthwash.
No, Mouthpaste.
I can leave the description in the comments.
We'll leave the description. We'll leave the description in the comments. We're going to do that. We're going to leave it in the description. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos.